Hello everyone, welcome to DocEngage. This is Jayashree. In this video, I am going to tell you about what is chatting and how to do chatting in DocEngage. Chatting is a place where you can have complete record of patient's clinical data and medical history, where patients chatting keeps patient informations like vitals, diagnoses, medication, allergies, etc. So let me show you how to do the chatting in DocEngage. So to do the chatting, we need to create an appointment first. So to create an appointment, I can directly go to create button and quick schedule an appointment. So I'll select one patient and create an appointment for the patient called Sanjana with Dr. Ankit and save. Okay, let us change the time to 8:45 and save. So appointment has been created successfully. Now to do the chatting, we'll go into the provider calendar and we can see the complete appointment details of the provider who has logged into this DocEngage. So let us imagine the patient is already come to hospital to take the service. I want to send the patient into doctor's cabin. From the status schedule status, I will change it to check-in, which means the patient is going to take the service now. I'll check in. If I check in, it will directly redirect with the chatting page where I can capture the vitals, add the notes, write the prescription. For this patient, there is all vitals already recorded. If I want to record the vitals, I can just record. I'll write the height and weight of the patient, the temperature. Okay, I'll write capture the temperature and also the systolic pressure, diastolic pressure, and I'll even capture the pulse rate, glucose level. After capturing all the vitals, I'll save. To capture the vitals, even a friendless person or a nurse can also take this. Nurse can take the vitals and send the patient into doctor cabin. So now let us imagine that the patient is sitting in front of doctor and I am the doctor. I want to capture the notes. Whatever the patient is telling, I want to add that into the notes. So let us say I have one mic option here. If I click on this, I can directly speak what the notes and it will write it on its own, or else I can take the sections templates which I have created from settings. I will show this how to create sections and library, note library in the end of this video. From the settings you can do the add the templates. Now let us say I want to add the history. I can take this section and write the history, and I can even write the symptoms by clicking on this section, or I can even create one new section. So symptoms, let us say knee pain, knee joint pain, then ankle pain, symptoms. So I can even in the history I can capture that uh, occurred since 1 year, from past 1 year. Treatment has not been taken. So I can capture all the notes and prescribe the medicine based on the notes. So I can even use the tags. Based on the tags also we can create some new tags, and based on the tags also we can filter the notes here, and even we can use the tags from here as well. From on the based on these tags we can add, or for example let us say I want to remove this section, so I can remove the section like that, or I can even add the section tags here. And next is prescription. In the prescription, so now based on the notes and the symptoms which patient has told, I'm going to prescribe a medicines to the patient. So patient, I'll prescribe Folitrax 10 mg, and dosage is 1 before meal and after meal, morning one and night one for the 30 days. I'm giving the duration as 30 days, And I can even write the instruction here twice a day after food. Starting from today, this patient has to take the Folitrax 10 mg tablet. Let me prescribe one more. Foliate 5 mg, and I'll write the dosage and what is the duration for 30 days. If I want to add new medicine fields, I can add new medicine fields as well. And I can even add from the templates by clicking on the templates. I can add, if I want to add any custom medicine, I can add the custom medicine which is not there in our pharmacy. This is the medicine which I want to prescribe. And I'll write the dosage 10 mg. Sorry, I'll write the strength. And after that, I'll write the dosage and duration for 30 days. After this, I want to give a follow-up date. Follow-up date is like after I want to give the treatment after 30 days. So let us say after 30 days, I want to treat this patient again. I'll write the notes. So follow-up, consultation. Now I have captured the vitals, written the notes, and I have even prescribed the medicines and given a follow-up date. Now I have one option here called checkout, and the status has changed from schedules to check IN. So whenever a patient has whenever you have created an appointment for a patient, then the status will be scheduled. If you do the check-in, that which means the patient has gone into the doctor cabin and she is taking the services, which at that time the status will change to check-in. Now you want to complete this appointment, so I can do the checkout. Appointments as consultation, appointment status changed to completed. Sorry, from schedule to it was in check-in. Now check-in to it has gone to completed. Now I can save and print the prescription, or you can save and preview, or I can even save and print as well. So this is how we do the charting. In the timeline, if I go to timeline, I can see the complete clinical data like notes, medication details, vitals details. I can see, I can even load more and see the past data as well. And in the schedule, I can see the complete appointment created for this particular patient. In the timeline and even the financial, I can see the complete finance related data here, like how many invoices created, received payments, all the data will be seen here. Even the mode of payment also can be seen. In the financial, I can see the wallet amount and what is the paid amount by this particular patient and what is the due amount as well. And in the engagement, I can, if there is any calls or messages sent to that patient, then in the engagement it will show the details. And then profile, if I go to profile, I can see complete details of the profile details of the patient. For example, when we have captured when we have registered a patient, what and all details we have captured, it will show in the profile page, and we can see the sticky notes here. If I want to write any important clinical notes, I capture here in the sticky notes as well. And edit, I can edit this by clicking on edit patient form will open, where I can modify the data and update. So this is how we do the chatting. And here in the schedules appointment section, I can see the past appointments and the future appointments as well. Now let me show you how to add the notes library and note sections. To add the notes library and note section, if I click on settings, and if I go into templates, I have note field here. If I go click on this, note library will open. And if I go to note library, I can see all the categories here. I'll select clinic notes, and then if I want to select any specialty, I'll select the specialty. Let us say general physician. Sorry. Sorry. So I can select the specialities, and I can even write the tags with condition. If I want to write any tag, I can write the tags. So let us say DER. I can add the DER and create one notes chief complaint. This I'll write in the last. And in chief complaints, I can capture all the notes. If whatever notes I want to add, I can write the notes, and even these are the sections which I have already created that I'll show you. I can write the history, any history I can capture, write the notes here and save. I can write the complete note library like this, and all the note library which I have created will show here. If I want to mark any notes as important, I can just mark this as mark this star as yellow. Now this will become the important notes. And in the if I go to this note section here, I can create new sections which will be shown in the notes in the chatting page. So I can write the name here, for example, symptoms, history, chief complaints, or complaints to medication. I can write the note section, and if I want this short, I can give a short name. This short name will be the template name, which will be shown in the chatting page. If I want to select any category, I can select the note category and just save. This is how we add the note sections. I hope you all understood. Thank you all.